This is, I think, a really important slide, and it's critical in today's discussion about health reform and health care in general. This is a recent demographic study of the need for primary hip replacements, that's this line down here, and the projected need for knee replacements. In 2005, there were about 200,000 or 300,000 hip replacements per year in the United States of America, and about 500,000 knee replacements in the United States of America. As you can see, the projections are just continued steady increases, almost twofold by 2030, and the need for knee revisions, for knee replacements, are projected to just skyrocket. This is not unique to knees or hips. Spine surgery has a similar curve. Coronary artery stenting, similar curve. Other procedures are expected to need to be required in greater and greater numbers, and that is a big problem. Who can possibly pay for this stuff? These are expensive operations, and the cost of this is going to be huge. The bigger problem is who's going to be doing these things. I mean, right now, this is the estimate. We expect that in just a short time, 6 or 7 years, there won't be enough of us to do this. And I believe this is true. I'm already seeing there aren't enough of me in the course of a day or a week, and it's not a small point. Generally speaking, medical schools have increased by about 10% in the last 10 or 20 years. But each individual physician now graduating from medical school and finishing their residencies tends to do about 10 or 20% less than my cohort did. So just in terms of hours per week, patients seen. So in fact, we're losing effective surgeon hours as the years go by at the same time that the need is going up. Conventional hip replacement has evolved over time. You're familiar with these old style evolutionary biology trees, and the implication was that evolution occurs vertically, that it is targeted toward the ultimate, the perfect final answer. And in fact, in hip replacement, there have been considerable improvements over the years, and really the hip replacement that we do today is so very different from the one that we did 15 years ago even.